Welcome to your ANJC Health Tip. I'm Dr. Mike Kirk. When it comes to women's health, there's an abundance of misinformation that's circulating around. One day you're told to do one thing, the next day it's the total opposite. To help set the record straight, I'm here with Dr. Annette Schippel. Dr. Schippel is a chiropractic physician, international speaker, and educator, as well as a natural health expert who focuses in on women and children's health, as well as clinical nutrition. Welcome, Dr. Schippel.
Thank you very much. I'm glad to be here.
So let's go ahead and jump right on in. When it comes to women's health, there's not a conversation that doesn't go by where estrogen is not the main focus. In addition to estrogen, what other factors should women be paying attention to? What other hormones, what other areas of their health should they pay attention to?
So this is kind of the crazy part, because they're sort of led to believe that estrogen is the major issue, and if they could just balance that, suppress it, give more of another hormone, that somehow it would be better. And the truth is, it's not that simple. So when we're looking at it, it's really important to look at her whole body, her whole system. And actually, when you get into it a little bit deeper, the whole system, the stress handling system, the thyroid, the ovaries, everybody integrates with each other. And when you take that into concept, it turns out to be very, very different. I think one of the big things that I see is that it's the stress. It's like the chronic stress. So it sort of gets sort of covered up, right? Sure. Like, oh, you're just tired because you've had kids, or you're just tired because you worked, or, you're emotional because of this. And there's like this pill to fix everything instead of really getting to the root cause. And one of the things that I try to relate to both my patients and also the doctors when I talk to them about is that role that stress and those stress hormones, how they influence the other hormones in the family. So this is where it becomes more than just estrogen. Sure. We're looking at the balance of progesterone, neurohormones such as dopamine, GABA, not to mention cortisol. And everybody wants to block it, and it's like it's your best friend. You die without it. But when it's out of balance, it kind of can wreak a lot of havoc. So it's really finding someone who can view you as a whole person, but there's also just a lot of really, really simple things that we can do to make it much better.
So along that line, again, in my office, and I'm sure with yourself there, you see a lot of women coming in with excessive amounts of stress. In general, women have a tendency to put everyone else's needs first before their own, and as a result, they experience tremendous amounts of stress. What would be two techniques that women could utilize almost immediately, if you would, to help reduce their stress?
Okay, so I'm a chiropractor and a mom of 4 children. So, I totally get this.
No stress, right?
I know, right? I know. And I did it all, going through school, so it was really insane. One of the most important things, is to give them permission to take care of themselves. You just said it. They put everybody else first. They're not even on the list of the to-do list. They're not even there. And I love the analogy of, because we've all flown, right? The airplane analogy. Sure. Of the oxygen mask drops. And I tell them this all the time. It says, it does not say, put it on everyone else around you and then yourself last, because you will have passed out by that time and you are no good to anybody. But you've got to take care of yourself first. So it starts with little things. Little things is like, where can you delegate responsibility? How can you get more sleep? Going to bed at a decent time. You can get into the nuances of diet and of exercise and so forth, but they're so guilty. We take on everything. We feel bad about everything that goes wrong. So just kind of giving them a chance to breathe. Just breathe. Take it easy. Get a good night's rest. And one of the big things is to just walk. Just walk. Because what happens is we get kind of out of balance. We want to eat less and exercise more. Because then we'll feel better and we'll lose weight and we'll and it all goes through this. And then, of course, that makes it worse. So I said, just walk. Get a 60-minute walk in that's leisure. You can split it up. But do that, because one of the things that it will do for them is, one, allow them a chance to breathe, right? Sure. Yep. But it will actually lower cortisol. And that changes everything, because it changes their levels of progesterone. It changes the balance of progesterone to estrogen. It changes dopamine, prolactin, all these other things that kind of sound complicated at first. And they don't need to know that. They just need to know that adequate sleep, walk. Really great, really easy, right?
Simple techniques that have massive results, right?
Yeah, and I think the most important thing that I would say is, do not ever tell them that they're going to be able to eliminate stress, because that's never going to happen. So you want to let them know that stress is okay, and it actually can be a very good thing, and it's about how we adapt and how we handle it and how we perceive it, and that's really kind of at the heart of it. And you do that early on, and it makes everything about aging so much more graceful.
Perfect. So you just mentioned aging, which is a good shift here for us too. I consider chiropractic and nutrition to be a powerful 1-2 combination when it comes to reaching your optimal health. Why should a woman integrate chiropractic care as well as clinical nutrition to help her age gracefully and to reach her optimal health? What role should it play?
You know, it's interesting because it wasn't until I really got into nutrition that I appreciated what we call the subluxation complex, right? The whole dynamics of what goes on. And the reality is that when it comes to the adjustment, you know, and to me that should be part of our wellness, proactive, how we take care of ourselves. But when you remove interference, you remove those, that's a physical stressor. When you are out of alignment, that is a physical stressor that is going to yank the chain of your hormones, yank the chain of your emotions, digestion, and so forth. So to me, it's as important as exercise, massage, and eating right. And you know, I often tell my docs, and I think about this a lot, is, you know, we've heard Thomas Edison's quote, right? The doctor of the future will be more concerned with the frame and the nutrition and so forth. That's us. That's like us, like right now. And that is the adjustment. That is what we eat, how we exercise, if we need supplements to fill in the gaps.
Right.
But to me, it is essential for all my patients, whether it's getting an adjustment by me or by a colleague, that it really makes such a difference for them.
Yeah. Fantastic. It's a powerful combination. I think
it is.
everybody should implement it into their healthy lifestyle plan. So
course, yes.
fantastic. In conclusion, as we wrap up things here, I'm always a huge fan of giving action steps to the audience. So as they're done tuning in today, what would be the first 1 or 2 things that you would recommend that would have the most powerful impact on improving their health?
Okay, so we covered that they could get adjusted, right? We talked about sleep. We talked about just walking, you know, not aggressive exercise, but just get out and get walking. There are other simple things. Just from a dietary standpoint, I see that this is a major issue. Not enough protein and not enough fiber. So if we don't have enough protein, we don't have enough building blocks, we can't rebuild ourselves, we can't maintain our lean muscle, which has been shown to decrease as we age. So actually our need for protein actually goes up. The benefit of fiber is that fiber will bind to all sorts of nastiness. It'll bind to excess hormones, it'll bind to toxins, things that we really don't need to have, and to be able to eliminate them without them going to recirculate back through the system. So these to me are things that our patients, our women, can do just on their own. Look at quality protein. You know, organic sources, try to avoid soy because that can adversely affect female hormones. Incorporate more whey protein because that is a precursor for glutathione, so it helps with detox and inflammation. So really nice, good, clean sources of protein. And fiber, I think, you know, traditionally we've just gotten less and less and less as the years go on. So if we can find more ways to get fiber, healthy gut lining, healthy colon, and again, we get to bind to those hormones and toxins. So, you know, things they can do, yeah.
Perfect. Thank you. Thank you for your time. We appreciate your time and expertise.
Thank you.
There you have it, another ANJC health tip to help you reach your optimal health. If you would like more tips, tools, and techniques similar to this, you can head on over to njchiropractors.com. And while you're there, you can search for an ANJC doctor located in a town near you to help you reach your optimal health. Till we speak again, remember to stay healthy.